What is my sole purpose as a teacher is to motivate students to be compassionate. Because the technical side anybody can teach, but you can't tell somebody, please be compassionate. You have to model it. I came from India and I used to live very near the railway tracks. They were quite exposed and I often saw injuries, and so I was very much motivated to be something in healthcare or go into medicine. You must be excellent in whatever you do to your patients. Not only should we understand the biology and the science behind the disease and treatment, but you should understand the social and economic background, both of the individual and the environment in which medicine is practiced, because that is what will influence how patients perceive, what are their expectations, and how do they themselves behave. When my interaction with students, I always tell them, you must have a very good conversation with patients. You must understand them completely. Communication skills are something that we must model, because you can't only teach them. You can teach them the principles, but they must see how it's modeled. I give them an opportunity to observe first how I approach the patient, and then they do it themselves.
And most patients come in and once they see him, they're very, very happy. It is like seeing an old friend. It's a trust.
That's being a sensitive and a caring person rather than being just a technically competent doctor. And I think this is what I'm trying to model, that is important to be a caring person, whether you're a doctor or a nurse, and I think that's a very good model to set up. You must be compassionate and caring, and I think is a very important philosophy in the practice of the art of medicine, or the art of healing, if you want to call it. The time available for imparting knowledge one-to-one is greatly reduced. So we thought that before students came to our clinical sessions, maybe we should give them some resources so that they could train and practice.
And he also has an OLC learning platform. He has a website set up, and it's got all these videos and tutorials and takes you step by step through different learning modules. And I found that very helpful. In the background there was Professor Kumta's voice as well.
We give students some electronic resources before they come to the lecture so that they are well prepared and they can answer some questions, and we have some interaction. We can show some cases, we can bring in some patients. So that concept of pre-engagement is called flipping the classroom. It's very successful, and we have been doing that for a couple of years now. When I'm paddling, I'm thinking a lot. While you're enjoying, it gives you very good opportunity to reflect, to think, to understand. It's quite intense because you have to be very focused. You must know where you're going, and I thought that's very good for building your ability to plan, to focus, to get out of trouble, to stay out of trouble, and to be able to help people when they are in trouble. It's a combination of good exercise, both for the mind as well as the body. My 3 children love paddling. You have to show them what is the standard that is expected. If you want to reach a particular island, for example, you must have the stamina, and you must have the right boat and the right equipment, the right technique to be able to paddle there. Very much like teaching a profession. If you want to get to a certain level, you must have the right training, the right practice, develop the skills so that you can reach. And that's exactly what happened in the case of paddling with my children. As I do expect my children will be better paddlers than I am. In fact, they are. And I think I also expect some of my students will be better surgeons than we are.